So did your urologist tell you that he had to go hunting for your vas deferens? What's the deal? Is he some kind of outdoorsman? Hey guys, this is Doc Hepps. So you went in to get a vasectomy and your urologist did an exam and he's telling you he really has to hunt for the vas deferens. He's having trouble. What's the deal? So stay tuned, listen to the video. I'll give you some insight as to what's going on and tips and tricks towards the end of the video as to what to expect. So when you go in for a vasectomy, the urologist is going to do a couple of things. He's going to ask you your history and understand why you're coming in for the vasectomy. He's also going to want to do an exam. And the reason why we do an exam is to feel for this structure in the scrotum called the vas deferens. The vas deferens is a tube that takes the sperm from the testicle to the prostate. It's this small structure that feels like a piece of spaghetti, a soft al dente spaghetti that takes the sperm again from the testicle into this little tube. It loops around and plugs into the prostate. Now this is a long tube. Usually we can feel it in the scrotum pretty well, but there's a whole bunch of tubes within the scrotum. There's nerves, there's blood vessels, there's lymphatic drainage tissue vessels. All these things travel along in what's called the spermatic cord. Now, the vas deferens is usually pretty easy to feel, but sometimes, depending on a gentleman's anatomy, that vas deferens gets wrapped around different blood vessels. It gets wrapped around fatty tissue. Everybody's anatomy is a little different. And in some men, you can't even feel the vas deferens just because of their congenital anatomy. It's the way you were born. So oftentimes the urologist will give you the scoop on the vasectomy procedure. He'll lie you down and he'll do basically a testicle exam and he'll feel for that structure. Now, if the urologist is really struggling to feel it and you're kind of wiggling around, he may say, hey, I can't feel this vas deferens. I'm going to have to go hunting for it. And oftentimes, if that happens, he'll decide, hey, we can't do this under a local anesthesia in the office. He may say, hey, we got to knock you out, because occasionally, and this is fairly unusual, but it happens that if we as urologists can't feel it, we have to go searching for it. Because if we just do one of the vas deferens, that's not going to keep the sperm from getting into the ejaculate fluid. So sometimes if you have to hunt for it, sometimes when you're relaxed under an anesthetic, it becomes more, the vas deferens becomes more prominent. Or sometimes we have to make a little bit bigger opening or incision to go searching around for that structure to ensure that it's tied off and there's no sperm that are gonna get into the ejaculate. So tips and tricks. When you go to the urologist, understand that he's going to ask you some questions and he's going to do an exam. Ideally, the more relaxed you are, the more likely he's going to be able to feel that vas deferens. Because if you're really anxious and tensing, sometimes that makes it difficult to feel, although this is quite unusual. But understand that it's no fault of your own, that if the urologist can't feel it, it's probably just a congenital, you were born with thing, and it may be safest for him to take you to the operating room to further investigate and ensure that your vas deferens are totally tied off and the vasectomy is a success. So I hope you enjoyed this video. It gave you some insight as to what to expect when you go in to talk about the vasectomy procedure. I appreciate you watching. Make sure you subscribe and check out our other videos.